All right, good morning, gentlemen. My name is Mike. We're going to go over your pre-procedure instructions before you have PRK or LASIK, okay? First of all, you're having PRK this morning and you're having LASIK, so we're going to just break it down into two different groups, okay? This is your little piece of paper instructions. The doctor is giving you everything you can and cannot do, as well as how to take your medications. So every time you take a drop, just check this on this little block. That way you'll know if you took the drop and you won't forget, okay? First thing we're going to do is go over your medications. I want you to pull them out, and I'll explain them to you as you go. But I just want you to pull them out so I can make sure that you have all your medications. So first thing you're going to pull out is your steroid. It is a white box with a blue stripe down the side of it. You should have 2 of these. All right. This is the only drop you need to shake up, but if you get confused, just shake all the drops up, okay? But you're going to put this in your eye 4 times a day. The easiest way to remember that is breakfast, lunch, and dinner before you go to bed, okay? That way you don't get confused on how to take these drops. It's real simple. Shake them up. Put 1 drop in each eye, and then wait 5 minutes before you put your next drop in, okay? The next thing you should have in there is your antibiotic. It's moxifloxacin. You're going to use this 4 times a day as well while you have your contact in. It's to make sure that you don't get an infection while you're sleeping in this contact. It's wearing your contact 24 hours is everything against everything you have been taught. We just want to make sure that you don't get an infection, so use it 4 times a day. So put your steroid or any drop in first, wait 5 minutes, and then put your next drop in, okay? That's just so you don't wash the effect of that drop out before you put the next one in, okay? That'd be all your drops. Inside of the funny little hat that I gave you, it has 2 boxes of tears. You do not have it in there right now, but you're going to use that every couple hours you'll wake. You'll find out using these tears makes your eye feel better, okay? If any of the drops sting or burn, you can always put them in your refrigerator, and when you put them in the refrigerator, cool them off, sometimes it makes them feel better, okay? So just that tears, because we're going to disrupt your ability to produce tears today, you'll find out that those tears make your eye feel better. And this is an example of the tears that you would use, Refresh, or something that we gave you from the clinic, okay? And you're going to use these every couple hours you're awake. There's 2 bottles in here. So when you go back to work, you'll see that you have 2 bottles of your steroid and you have 2 bottles of your tears. When you go back to work, you can just leave 1 at home or 1 at work. This leaves you the ability to be able to use your drops all the time, okay? Because you're going to have to use those at work, all right? But by the time you go back to work, you won't be using that antibiotic. Once your contact lenses are taken out, you don't need your antibiotics anymore. Are there any questions on your drops? All right, you should have some Percocet in your bag. You don't have any Percocet in there right now because you're not giving it to the pharmacy. The medications I'm talking about now, the pharmacy, the Percocet, the Motrin, and all those are picked up from the pharmacy, okay? The Percocet, you're going to take 1 to 2 tablets every 4 to 6 hours, just like it says on the bottle. If you want to stay ahead of your pain, when you leave here today, you'll be in absolutely 0 pain because we're going to numb your eyes during surgery, okay? But when you get home, you're going to want to make sure you get on the Percocet. Are you both here from Fort Campbell? Yeah, okay. Just start your medications before when you get home, okay? If you're from Fort Knox or another location, I want you to take that Percocet before you get on the road, okay? You'll have Phenergan or Ondansetron. These are an anti-nausea medication. You'll take those 30 minutes before your Percocet. And I know, I was in the Army for a while, and I know that you often get Motrin. If you take it, you don't worry about eating or doing any of that stuff, right? But you're going to be taking Motrin, Percocet, Phenergan, or Ondansetron. And you want to make sure that you take that stuff before you take the Percocet, okay? Because you're going to get an upset stomach. You're taking vitamin C that we've already given you. Make sure that you take that vitamin C or that Ondansetron or Phenergan before you take those medications, okay? Are there any questions on your drops? Are there any questions on your pill form medications? The Motrin, just take it as prescribed, okay? All right, now we're going to go on to procedure. Each one of you have a name band on your wrist. I want you to check that 1 more time before you take your diazepam, because you'll forget what's going on. So look at your name band. You don't have a name band, but look at your name band just to ensure that we have the right patient, okay? We've already verified that at the front, but we're just going to re-verify that because from once you take your diazepam, which you're going to take here in a few minutes, we're going to go off of the name band, all right? Diazepam, you have 2 in there. You're going to take 1 before you go into surgery. The second one is for tomorrow night. Just take it 30 minutes before you plan on going to sleep, all right? When you enter the room, there's going to be a little silver table. Bring all your medications, and if you don't have a driver, put them on that little silver table because you have Percocet in that bag, and that's the magic one that always comes missing, right? Okay, we all know why. Boom. All right. When you go on back there, we're going to have you lay on the bed. You're going to slide on back, facing up. This is not a back massage. You're going to be facing up. We're doing eye surgery, okay? So just roll on back. We're going to have you raise your left arm. The doctor's going to tell you to state your name and the procedure you're going to have today. You're having PRK, so you're going to just say I'm having PRK. You're having LASIK, and I'll go more in detail of LASIK when we get to that, okay? But just state your name, date of birth, and you're having PRK today, okay? Once you slide on back, you're going to hear me or the physician with the laser tech rattling off numbers, and the staff are just verifying your prescription is correctly, okay? Once they're done with that, we'll have you put your arm down. We're going to put a little wire thing in your eye to keep your eye open. You can fight it, but you know that metal always beats tissue, right? So just try to relax as much as you can. And I know eye surgery and relaxing does not go together. We all know that, right? Then, depending on your surgery, they're going to do two things. They're going to either have something that creates a lot of pressure. Both of these instruments will create a lot of pressure. One will have fluid in it. One will be like a toothbrush thing that just removes the front surface of the cornea. Once that's finished, you're going to hear it. They're going to clean it up a little bit. You're going to hear the laser tech saying laser head is coming down. That's just it, and it'll start tracking. You'll hear the laser tech say it's tracking, okay? This is not Scary Movie 3 or Final Fantasy, I think, or some Final Destination was the movie, where this guy got lasered in the back of the head. This laser actually has a tracking system that tracks the movement of your eye. It makes micro movements. If you were to get startled and somebody behind you scared you, and you look completely behind you, the laser would shut down, okay? So as you move little micro movements, it's tracking and putting that prescription exactly where we want it, okay? So you will not get lasered in the back of your head like some scary movie, okay? Once that laser is finished, depending on your treatment, we'll put additional medication on there for 20 seconds. Once that's complete, we'll wash this off with ice water. It's completely on ice water, been on ice water all day unless you get the surgery in the afternoon. It's not been on ice water all day. It's very cold. That's the worst part of the procedure. It's to cool your eye off after the laser. Once we're finished with that, we'll put your drops, basically what you have in your bag, in your eye, put a contact lens in your eye, and go over and do the other eye exactly the same way. I often say this is like brushing your teeth. If you can brush your teeth properly, not that we all do, right? We're not with our business, right? That's how long you're in the room for the procedure. Okay, it's literally that long for the procedure to do both eyes. The rest of it is cleaning processes and the processes that staff have to do that surgery, okay? He'll go over and do the other eye exactly the same way. You'll come out here and sit for 10 minutes. Once you're finished with 10 minutes, you can leave. You have a contact lens in your eye. What is the purpose of the contact lens? It's a Band-Aid. You have a wound, you put a Band-Aid over it, right? So if your eye is constantly blinking over that area that we just treated, so we put this contact lens over that so you don't have the pain.